Imagine receiving a life-saving medical diagnosis, but realizing you have no physical or financial way to actually reach the doctor's office. For thousands of New Yorkers, non-emergency medical transportation, or NEMT, is the literal lifeline that bridges the gap between Medicaid patients and essential healthcare facilities. But tracking who needed a ride and why used to be completely decentralized. There was no single central authority monitoring fleets of vehicles picking up patients across the state. While booking a ride directly with a local company was easy for the patient, a system operating completely in the dark made that medical lifeline an easy target for exploitation. As this chart detailing Medicaid payments shows, without a central tracking mechanism, the state was dealing with rampant overbilling, unverified trips, and fraud on a massive financial scale. New York State had to stop the bleeding. They needed a strict mechanism to verify whether a requested trip was actually medically necessary before paying the bill. The solution they built is known as Medical Answering Services, or MAS. MAS doesn't operate vans or hire drivers. It is strictly a logistical gatekeeper, a centralized barrier designed to introduce accountability into a chaotic system. To see this gatekeeper operate, we look at the daily process. MAS owns 0 vehicles. It acts strictly as a middleman broker. A patient with Medicaid formally requests a ride, passing appointment details directly to MAS. MAS evaluates if the patient qualifies under state guidelines and if the trip is medically necessary. Once approved, MAS assigns the trip to a licensed provider. The patient is strictly prohibited from choosing the provider themselves. By intentionally stripping away the patient's ability to pick their driver, the state eliminated the primary mechanism for provider-patient collusion. The final step is completion. The assigned company arrives with one of 3 types of vehicles, dispatched based strictly on the patient's verified physical condition. For those who can walk with minimal help, MAS sends standard ambulatory transport. For patients utilizing mobility aids, they send an ambulette, a specially modified vehicle equipped with a ramp or lift. For non-emergency patients who must remain completely horizontal during transit, the system requires a specialized stretcher vehicle with a heavy frame to safely secure them. The strict tier system perfectly matches a patient's medical needs to the right physical equipment. But that same rigid logistical structure very often collides with the chaotic realities of a patient's daily schedule. Eligible patients receive this entire transportation service at 0 out-of-pocket cost. The trade-off is that they pay for it with their time and their autonomy. To keep operations running under budget, MAS routinely groups passengers together. A quick 10-minute drive home from the clinic often becomes a winding, multi-passenger ride. And because drivers are juggling so many shared assignments, patients frequently experience extended wait times for return trips. Add in mandatory advance notice requirements and occasional communication gaps, and trying to secure a last-minute or emergency ride through the system becomes nearly impossible. The logistical cost of a free, state-funded system is simple math. It has to prioritize systemic financial efficiency over the convenience of any single individual. For high-stakes situations where timing is critical, many families step outside the state network and look to private pay alternatives, like Swift Aid Transport. The private pay model reverses the trade-off. Patients pay out of pocket, but in exchange, they regain total control. They choose their specific provider, open a direct line of communication with the driver, and guarantee a reliable pickup for a hospital discharge or a time-sensitive appointment. If you are relying on the state system, you have to build in a buffer. Schedule rides as early as possible, strictly confirm your pickup times, and have a backup plan ready. The MAS Gatekeeper exists to keep the broader Medicaid system financially viable. Understanding those rigid rules empowers you to know exactly when to rely on the free network and when to step outside it to take ultimate control of your own healthcare journey.